Well, this time of year, many of us are trying to get in shape and lose weight, but for some of us, exercising is difficult or even impossible because of joint pain, difficulty breathing, or other health issues. But good news, Dr. Bill Johnson of Innovation Stem Cell Center is here to tell us about some revolutionary therapy that can enable us to exercise and move better. This is great news. Good morning,
Good morning.
to you. This is very exciting, and there are some issues. I mean, many of us make excuses for not exercising, but some of us literally can't because of joint pain. How are you able to help with that?
Well, a lot of folks have real trouble with knees in particular, but there are other joints too that keep you from exercising. And stem cell therapy is really starting to make a real impact for osteoarthritis or degenerative arthritis. Now, we use fat to get the stem cells. So we go in, liposuction. This is about the size of the area we liposuction. So we take this and we get the stem cells out of it. So, and then when we're finished, we have a 10 cc syringe that's full of saline and has between 50 and 100 million stem cells in it.
Wow.
We then take that and we can inject part of it into your joint, and we give part of it IV. About 80% of patients respond, and there's a study that should be published this spring that's showing many patients are able to avoid joint replacement and able to get back into exercise having had the stem cell treatment.
Well, and what I like about this is that you're not injecting any kind of foreign substance. These are your own cells.
These are your own
that you're
cells.
Using in such a way that can alleviate some of this joint pain.
Yeah, and we're talking about using your own cells from your fat, not anybody else's cells, not anything that's controversial or has a chance of rejection.
All right. So what about people who have difficulty breathing when exercising?
Well, we're doing our own study on COPD, and we do the same thing. We harvest some stem cells from the fat, and we give it back IV and have you breathe some. And small numbers right now, but we know historically patients with COPD lose 1 to 2% of lung function a month, and we're seeing that reverse. We're seeing 1 to 2% improvement.
Wow, so it's reversing that trend.
So it's reversing a trend. It's not a dramatic difference. They're not jumping up and doing marathons, but they are starting to see gradual improvement as opposed to the gradual worsening they've been seeing. Same is true of heart failure. We're seeing some real improvement with heart failure when we give it IV and seeing them able to now participate in their rehab programs, get into starting to be able to exercise and move around.
All right, what about other issues that people might have that would prevent them from exercising? What other options do you offer?
Well, we really are seeing some nice responses with patients with rheumatoid arthritis, which is different from osteoarthritis, and from lupus. We're seeing real improvement in they're being able to have their energy levels back up, have their disease activity turned down, and so they're able to get into exercise. We're also seeing some improvement with patients with neurologic conditions like peripheral neuropathy. We're seeing improvement with MS and some other diseases that now folks are able to get back and get into rehab and start exercising.
All right, well, let's talk about why you choose to pull the fat pull the stem cells from fat instead of from bone marrow.
Well, if we do a bone marrow harvest, we can get about 20,000. Now, the cells themselves are microscopic, so we're using this as a demonstration. So if I get a really good bone marrow harvest, I'm going to get about 20,000 cells. It's going to be about that in volume.
Wow.
If I get an average fat harvest, I'm going to get between 150 and 100 million cells. So that's comparing this amount to this amount, and that's the difference we're talking about.
That is a dramatic difference.
And everyone believes the more you get, the better.
Right.
So it really makes a difference. They're both mesenchymal cells. Most people believe they have equal capacity to go and do the job. So we just get so many more from fat than from bone marrow that it makes sense. It's also a little bit of issue. We get more when we age. Our fat stem cells tend to continue, and it drops off quite a bit as we get older in the bone marrow.
Well, and you're such a partner with people when it comes to making these improvements. You've got a special offer as well.
Well, right now, for the rest of this month, we're still on our cosmetic side, and we're still offering $500 off on the liposuction for what's left of January.
It's fantastic. It's so revolutionary. I'm very happy. And I'm also happy about your new locations in Frisco and Fort Worth. Thank you so much for being here, Dr. Bill.
Thank you.
Appreciate it. And again, you can jumpstart your healthy new year by calling 214-669-6948 for more information about stem cell therapy, or log on to innovationstemcellcenter.com.